In this lesson, I'm going to be explaining breastfeeding and your role in helping the patients be successful and educated. All right, so let's start off with just some basics to go over. So the first feeding, it's important that is initiated as soon as possible. Within the first hour is what we like to see. So the best way to do this is the second that baby's placed up on mom, we put the baby skin to skin, and that can help initiate this first feeding. We also want to just help the mom be successful with whatever her wishes are. But the current recommendations, that is the American Academy of Pediatrics, and they say that breastfeeding should be exclusive, so no supplementation or anything for the first 6 months. And then we could start, it could even be pumped breast milk, and that's fine, but then not to add any food or formula until after 6 months. So exclusive till 6 months. And the World Health Organization, they recommend it lasting until 2 years of age or even older. So every baby has to learn, and mom has to learn. So this is not easy. The baby's used to being inside of that amniotic fluid, opening its mouth and getting nutrition through a cord, not really having to work for food. Well, now the baby has to learn to suck, swallow, and breathe all at once, which is not easy. And then the mom has to help with comfort and positioning for herself as well. So just helping support that mom in however we can do to make her successful. Mom's tired, babies scream, middle of the night, they're ready to give up and quit. And it's not easy. So your role is to be that positive support and encouragement for them. So our assessment for this patient is going to include a few things. We are going to be assessing both mom and baby. So for the baby, if we look at the stool, first you will see the meconium. Now this is on all babies. That's that tar, very sticky black stool. And then it's going to transition. So the breast milk poops, they will transition to a seedy yellow color, and it really does look like there's little seeds in those diapers from the breast milk. So that is what we'll see for a breastfed baby. Now, breast milk can sometimes act as a laxative. So sometimes their stools will be a little bit more watery, and sometimes they go very frequently, and that's okay. That's normal. For the mom, we are going to be checking for engorgement. So this is when the milk comes in and she's going to be really engorged. Her breast will feel hard and be a little painful and tender for her. And that's normal. She's engorged. Her body's like, okay, here's all the milk. So then it's there. And then her body has to figure out how much it's supposed to make, and will adjust and make her not feel as engorged later. And then two things that we're assessing for and watching, a mastitis and a clogged duct. So mastitis is when we get a bacterial infection. A clogged duct occurs and milk can back up and get infected or cause an infection. So this patient will have very painful, tender breasts that will have a red spot area where that mastitis starts. And then she will have a very high temperature because of a bacterial infection. The clogged duct is when it's a hard, movable ball, and hopefully we can handle that and get rid of that clogged duct before it turns to mastitis. So as you can see in this image, these ducts here, it will get clogged, and that's the clogged duct. So it gets clogged with milk, and we have to try to get that milk out. So just more frequent feeding and all that. Otherwise, the milk's going to back up, and that's when bacteria can grow. So our management for this patient will be to promote the first feeding as early as possible. So that first hour is our hope. And then putting that baby skin to skin will help to initiate the feeding. Breastfeeding is really hard. So we need to offer as much encouragement as we can for this patient. Just showing her the positive signs that the baby's had a wet diaper. Babies aren't going to pee if they're dehydrated and not getting enough. So this will help be a visual for her to see and encourage her that her baby is feeding and she's doing a great job. Nutritional requirements. So they're going to change a little bit. When mom is pregnant, she could have 300 additional calories a day. Well, now she can have 500 extra a day, which is super awesome. So she gets to eat more. So we need to make sure that she's drinking enough water, as well as just eating healthy foods. She also needs to continue her prenatal vitamin just to make sure she's getting the nutrients that she needs. And then we're going to be assisting mom with feedings. So the best thing to do, we want to make sure that whatever position that the mom's feeding in, we always have tummy to mummy or belly to belly, but that baby's in line with the mom. And that is going to help promote a good latch because we have good positioning. So some of the positions we can do, there's one called biological, which is thought to be the best position currently with research. So the biological position, this is when the baby is straight up and down on the mom. And it just helps to keep the baby awake a little bit more. It's kind of like they're sitting up at a table, so it keeps them awake. The other position that is what most people go to is the cradle position. So this is where the baby is lying transverse across the mom's stomach and latches on. And that's fine. The baby can just get a little bit more sleepy in this position. So the big thing is we want to allow the baby to open its mouth to get as much breast tissue, as much of the areola in there as it can. So we're going to put the nipple to the nose and the baby will hopefully open its mouth, get a big mouthful, and that'll help with a great latch. So the suck reflex on a baby is way in the back of the mouth. So we want as much breast tissue in there as possible to initiate that reflex and to start sucking. Sucking motions should be seen by rhythmic movement of the jaw. You can kind of see the ear moving up and down when they're latched on well. And sucking should also be silent. If there's ever any noise heard with sucking, then the infant should be detached or unlatched and then try again. A bad latch is not going to help anyone, okay? So we want to really make sure we're helping get a good latch. So the mouth big and open, as much areola in there as possible, and the lips flanged, kind of like fish lips, getting as much in there as possible. All right, so I wanted to show you this latch score. This is used to determine how well the infant's doing with feeding, and they're either going to be scored a 0, a 1, or a 2 for each of these to get a max score of 10. So this is done while the baby's in the hospital just to assess how well the feeding is going or the latch is going. So our L is going to stand for latch. If the infant is too sleepy, not latching, this would be a 0. If there are repeated attempts that we're having to get the baby on there, but the baby's only doing a few suckles with stimulation, then they'll get a 1. If the infant's wide awake, grasping the breast well, then they will get a 2. A is going to stand for audible swallowing. Now, this one's a little bit harder when the milk is not quite in yet. In the beginning, we just have that colostrum that's full of antibodies. It's the pre-milk. So they don't swallow as much with this. So for this, they're going to get a 0 if we hear no audible swallowing. If we have a few with stimulation, they'll get a 1. And then once the mom's milk in, they should really get a 2 for this because you're going to have a bunch of milk in. The baby's going to be suck, suck, swallow, suck, suck, swallow. And so they will have a lot of audible swallowing happening. T, this is for type of nipple. So if the mom's nipple is inverted, which means it's not sticking out, it's pointing in, they're going to get a 0. If it is flat, so there's nothing sticking out, which is flat, no protrusion of the nipple, they'll get a 1. If it's everted, then they will get a 2. So that's what we want to see. C is going to be comfort, and this is of the breast. So for the mom that's engaged or having cracking and bleeding, she's going to get a 0. If the breast is just filling, maybe has some blisters or bruising, this is a 1. And for the mom that has soft breasts that are non-tender at all, that's going to be a 2. Our H stands for hold. So this is the mom's hold with the baby at the breast. So if she needs us to completely help hold the baby, support the baby at the breast for feeding, she's going to get 0. If she, we can show her one side, teach one, and then she does one, then she'll get 1 point. If she can do it all on her own, then that's awesome, and she'll get 2 for that. So just make sure you look at this. It's a really big testing purpose thing, so make sure you understand the latch score and what each one stands for. Our education for this patient. So there's a lot, right? We got to teach her how to do all this, but some other big pieces. We want to make sure she's comfortable using a breast pump. If she wishes, or if she eventually is going back to work and going to be using a breast pump, then we need to make sure she has one and knows how to use it. We got to educate on the how. So this is how to be successful, how to get the baby latched, all of that. And then lactation consultants, we should utilize them. They can be really helpful to just reinforce education that we've given. And also just for those in-depth questions or for babies that are being totally uncooperative and we just can't quite get them awake and get them feeding well, then lactation consultants can be really helpful. Our concepts for this are going to be nutrition and human development, because this is our food source, and then comfort, because we have to help the mom with the comfort of the breastfeeding, the comfort of the hold, and the comfort of her nipples. So let's review our key points. So just the big things to remember. So breast milk is full of antibodies. It's giving the baby antibodies and added protection. It's going to reduce many health concerns. So that's why they highly recommend breastfeeding and exclusive breastfeeding for 6 months and even up to 2 years of age or beyond. And then no supplementation. So only exclusive feeding for 6 months. So no formula, no added food until 6 months of age. And then mom needs to increase her calories by 500 to make sure that she has enough nutrition for herself and to make milk. Make sure you check out the resources that are attached to this lesson. Review the latch score and just different scenarios to use it in. Now go out and be your best selves today. And as always, happy nursing.